What's up, everybody? Thomas the Tank here, and I have quite a video for you. Sourced this from Omegle and had an excellent conversation with this gentleman about healthcare. So it is a little bit long, but watch all the way through. He gets real angry at the very end. And I like to think that I stay courteous, but conversations like these, that's just we all have our own opinions and we're strong-willed. So here we go. Make sure you like and subscribe, and thank you so much for watching.
Your main focus was less of a federal government and more towards the people.
Smaller government, less taxes.
Smaller government, less taxes. So how do you drive what do you drive on when you're in a car?
On the roads. And they take care of that. Yeah, I'm fine with that. I'm not a total anarchist. Like, I know that there are some things that have to be.
What are you against?
What am I against?
Yeah, that's considered big government.
Socialized healthcare beyond
Why?
what it is right now. Because most people have private healthcare and they're able to determine the level of their service through capitalism.
But do you not realize that there are more people in the U.S. that are not insured than any other first world country with insurance?
Some of these people don't care about it, though.
No, that's not. Everyone cares about their health insurance. Everyone wants health insurance no matter what. You can say that for any country. Why is the U.S. the one country that people don't care about their health insurance?
Mental health people just don't care about it because if you have no dollars and you can go to a hospital. Hold on. If you have $0 and nothing to lose, in fact, you have $40,000 in debt and student loans and you're homeless and you have $0 and nobody can take anything from you, that's a level of freedom pretty close to. It's hard to beat that. But the thing is that you can go to a hospital and say, hey, I need care, and America can't refuse that. They can send you the bill.
That's where it is everywhere. Everywhere, you can't refuse someone anywhere.
Well, exactly. So it's not different. People still get health care if they want it. You don't have to have health insurance to go get health care.
Yes, but health care isn't only going to the hospital and dying. Like, as simple as just getting your teeth checked is considered like a human thing of needing to get checked out, or getting your eyes checked to see if you have glaucoma. Like, that's just a basic type of health care that people usually check up every few years. So it's not just going to the hospital and trying to get free hospital care.
I guess, but even still, most people have health insurance.
No, we're probably.
I'm not comparing us to anyone else. I'm saying most people in the United States have health insurance.
But with history, you have to base it off of what is good and what is bad, and we're considered bad with healthcare. We're
considered good with innovation, and our quality of healthcare is still much better than a lot of places. Sorry, go ahead.
If we're so good with healthcare, why do we pay the most in medicine than any other country in the entire world?
Because we have too much government involved. What do you think's going to happen if the government...
How is the government making the cost high?
Because they close an open market.
It's not closed. It's fully open. We have no say in how much...
But you want socialized healthcare, which would close the market. And then we just pay these blind insurance premiums, and the insurance carrier pays for the Band-Aid, the insulin, the shot, the broken bone. And you never see how much the actual cost is.
No, that's a what if. We don't have that right now. So why is it that we have the most expensive medicine in the whole entire world? We don't have an open. We do. We have the most. We pay hundreds and hundreds of dollars. Let's say insulin. We pay.
Oh, that's fair. I'm 100% on your page. I think the patent for that should be revoked, and it should be $1 over production to sell it.
But why insulin and not every other medicine?
Well, so insulin was invented by someone who didn't want to release the patent. Someone holds the patent, and they won't let it go.
That's every medicine in the U.S. The U.S. has their
penicillin. Penicillin and the cure for rabies are both totally open and available, unpatented, and they can't be patented.
That's great, but there are hundreds and hundreds and hundreds of medicines that are 5 times the amount here than if you cross the border in Mexico or Canada.
That would be because of the FDA.
No, that's not because of what the FDA does not regulate
Food
price.
and Drug Administration. They
It does not
require
regulate price.
they
No, it doesn't
require
regulate.
more thorough checks for production. So that's why you can go across the border to Mexico and get stuff cheaper, because it's produced cheaper and of
No.
less quality.
Our
That doesn't mean that
regulation is
aspirin here or
exactly-
there is different.
Our regulation is exactly the same in Canada. I'm telling you, Canada regulates their medicine exactly the same way that we do.
I mean,
They're not
you might know better
regulated
than I
less.
do. You got a bachelor's degree, but
That's the thing. It's like we're saying these things about healthcare, and it's just not the truth. Like, people can't afford these medicines.
they can if they have insurance.
We have the lowest amount of people that are insured under a healthcare system. So like, there's a lot.
Hold on. Let's be under a
there are
healthcare system.
millions
We're a partial system.
There are millions of people in this country that are not insured, which means they have to pay out of pocket, which means they die because they cannot afford.
What do you mean they have to pay out of pocket for what?
For medicine or care or anything.
I mean, I would
We
think
are the
that's
only
a
country.
really small portion of our
No,
population.
millions and millions. We are the number one country that has the highest population of that. You have to pay
Population
to
of
have a
what?
child here. No other country you have to pay to have a child. We force you to pay to get into an ambulance. Hundreds and hundreds and hundreds of dollars. Guess where it is everywhere else? Free to get into an ambulance to care for yourself. We are the only country that requires you to pay hundreds of dollars just to get help.
There you go. Well, I think that should be smaller. I think government intervention should be smaller, and there should be an open market allowing people to race each other
Open
to
market
the
is the
bottom
reason
on
why
price.
it's so high. Open market is the reason why it's so
So-
high
so
because
you're
they
s-
know that it's a need. Humans need to have an ambulance, right? You need to have an ambulance to get to a hospital fast when you're hurt.
Roughly. I mean,
You need if you got really hurt, you need an ambulance. You're not going to find someone to drive you.
okay.
Right? We are the only country that is making these people that to pay this amount of money because there's no government that's stopping them from saying this is the amount of money that cannot be exceeded. But these people are saying, okay, no one's telling us that we have a cap. So if everyone in this group of people that work in this group are saying let's cap it at $2,000 is the minimum that you have to pay to get into this private ambulance, then what do? You have to pay $2,000 because no one's stopping it, and all the companies are agreeing to do that. It's not like they're fighting for the lowest price. No, they're agreeing to what price to use.
Let's see.
What are you looking at?
I'm looking at how many people are uninsured.
A lot of people.
Let's see here. So what's Germany's population? This is just my random one. So 8.6% of the
Are you
United
looking?
States.
Are you looking at per capita?
So yeah, 8.6% of the population. Sorry?
People don't like to look at per capita. That's not the percentage of the population. It's percentage of a capita that's at, let's say, 100,000. How many people? Let's grab 100,000 people out of the U.S., 100,000 people out of Germany, 100,000 people out of the UK. U.S. is always
Yeah, it
the
would
most
still be
amount of people.
8.8%. So you can compare it percent-wise.
No.
You literally can. 8.8% of 100,000 is the same rate of per capita as 8.8% of 350 million.
And how much is the U.S. from Germany? Is what you're saying?
So I need to look up the population of Germany. I had this pulled up the other day, funny enough. Okay, 8.324 or 83 million 24. So there's my calculator. So it's dramatically less in Germany because there's 140,000 people living in Germany with no health cover. That's what it says. So that's Um, let's see. So yeah, 0.1% of Germany is so why is 0.1% of Germany not on health insurance if aren't they
But
universal
isn't
health
that
care?
crazy that 8.6% of the US, which is millions and millions
Yeah,
and
28
millions
million people. Yeah.
and millions of people that are not insured, and only 2% is uninsured in Germany. Do you know how many people die in the US for not being insured? Isn't that crazy?
Let's see. So what's oh my gosh. How many euros is that? 50 sorry, I'm like converting everything right here. Oh
No,
my
but
god.
what are you trying to say? What are you trying to do right now?
I'm trying to understand what the taxes are in Germany because something pays for that healthcare, right?
Yeah, they pay, they that's what's so great, that the money that they pay in taxes, they have a better outcome. They have better health insurance because they don't have to pay as much.
They don't have to pay as much for healthcare?
So they pay for their health insurance. They get it for free. So they pay a higher percent of tax. But
Yes.
the amount of money that they have to pay when they need medical help is nothing compared to the US. So we're spending more money in healthcare than they could ever even dream
So
of.
I would pay twice as much in income tax alone to cover this.
Yes, but you don't pay anything in premiums, in co-pays, in medicine, in doctor visits, in anything that you think of, that's not there. You pay more money in your health in the US than they do in the US in Germany, and they pay a higher tax percent.
They I mean, that's a huge tax jump though.
You're not getting what I'm saying. They get more
So
out from
I'm just
that.
saying it balances out.
It doesn't even balance out. They get more. They're getting tenfolds more.
So I'll just calculate what's my, so here, I'm gonna just go off my biweekly pay. So let me
No,
see
but you're
what
not.
that would cost
But
me.
you can do that. But you're not getting what I'm saying. You don't. You wouldn't have to pay for copays. You wouldn't have to pay for deductibles. You wouldn't have to pay taxes. You wouldn't have to pay medicine prices. You wouldn't have to say visits, all within the medicine area, because you just pay a flat percent for healthcare.
So it would
People
cost
don't
me
realize.
four hundred
People
dollars.
think that their personal tax is what pays for it. But they're forgetting, which is like kind of like you're just not as smart, because you're paying more money, but you're paying less taxes. Yeah, but you're still paying more money than they are.
No, I'm not. I pay,
Yeah,
so
you
my
are.
company pays $500 a month to insure me.
You didn't get what I'm saying. There's still deductibles. There's still copays. There's still
I pay
medicine prices.
$80 in copay a month because I go to my therapist 4 times a month.
Yeah, but
And
there's
that's it.
all abroad that say like you actually need, when you're older, you usually need a lot of you should go to the doctors once a year, and 10 different types of doctors you should
My
see once a year.
insurance will cost the same then, and then at that point, then so for me the difference would be $800 a month. That's $300 more per month than my current healthcare costs. And
All
I don't,
right.
and to be clear, I
I
don't
think
pay my current healthcare. My employer does.
Yeah, but guess what? You would get paid more if they didn't pay for it.
I seriously doubt that my employer would just be like, "Oh, well, here's the money that we were spending on you."
Yeah, because we're
No
not
way.
stopping that, because the government's not stopping it. Those countries, they don't make employers pay for their people's health care, which means they're able to pay their employees more money and have more employees, which means it's a better economy.
So what's like a normal? I guess you wouldn't know. Sorry, I just using Germany as an example because it's what I thought of. So
Let's just stick with Germany then.
perfect. Yeah. Let's see. So average income in Germany, 42,500 euros per year, which is roughly
Around 50,
45,000,
yeah, it's around 50,000 here.
50,000 here. So um,
That's, I would say we make less money than that here. We probably, our minimum is our
our average
medium.
is 31,000.
Yeah, how sad is that?
I mean, that's a great income if you live in Nebraska.
Do you know? You just said that Germany is paid an average of
The
$50,000 a
take
year
home is
with
the
not
same.
having to spend any money in healthcare, really. That's with taxes out, and we make 30 something thousand dollars, and we still have to
Not
pay
we. I make
10,
more than double that.
and we're paying. We're talking about average. I'm not talking about you. I don't
Yeah.
care how much money you make. We're talking about the average amount of people. Obviously, people make more money in Germany than their
Well, it's
average.
a more expensive place.
No, it's not.
Germany?
It's the same. You're just pulling things out of your ass, sir.
Um, Cost of living in Germany. Oh, even compared to US. We'll just do that. Someone has probably written a whole article on it. So, yeah, let's see here. You will need around 861 euros a month to cover your living expenses in Germany. Well, that's living expensive only. That doesn't really.
Sir, come on. You know what we're talking about, and you know what I'm saying.
Well, I mean, but the difference is that I mean we're talking about two different places that have dramatically different living lifestyles, right? I live in a small city, well, not a small city, but a dramatically smaller city than New York.
They have dramatically small cities there too compared to Berlin.
Well, yeah, but New York is how big is Berlin compared to New York?
They're both very, very big cities. They probably have bigger cities than we do. They have like one of the biggest, oldest cities in the whole entire world.
What I'm saying is it all balances out though, and I don't like that
If it
system
all
for
balances,
myself.
if it all balances out, then this data that you're telling me that debunks what you're saying is true.
That's fair, but we can't just all have the exact same system. The reason
Well,
that
no.
people choose different places to live is because they
What we're
like the way the system is. It all balances out because their taxes are higher and their income is higher. So their take home is about the same. Maybe a little
you
bit
just
more, but it's an
you just
expensive
confirmed
place
to
to live.
me you just confirmed to me that they make more money than us, and we pay more money in healthcare than they do. We have to pay more money
I never
as a
said we
living.
pay more. I'm talking about myself, a normal person under normal
Sir,
health
you're only
insurance.
talking about the average. You've only said the word average. I don't care about how much money you make. I don't care. We're only talking about the average amount of people. You've only said average. Obviously, you can try to find someone that's similar to you in Germany, but you're only talking about the average. I don't care about how much you make.
So, well, the average cost of health insurance in the United States is $541. So my average is the average.
That's great, but you said that the amount of people that are uninsured here is a lot higher by millions and millions compared to Germany.
Yeah, that's fair. Our population is dramatically higher.
No, you're talking about per capita.
Well, yeah, that's fair. That's fair. No, you're right on that.
I know, but this is the thing. Like you're trying to like it's the truth. Like what I'm saying is the truth, but you cannot go beyond that boundary of what your
So
side
so but
is
are
saying.
you okay paying twice as much in taxes? Are you okay
Yes, because I'm paying less, and you just proved that to me.
paying less how? You're paying the exact same.
No, if I wanted to go to the doctors, I'd be paying. If I wanted to go to every single doctor,
Your
and it was
copay is
paid by my
$20 on
state.
normal insurance, 25 if you got bad insurance.
Says who that I'm not? Who says who that I'm not? That I'm insured.
Then you pay nothing.
No, if I went to go to the hospital and say I have no social security card, but they'd be like, you have a social security card. Obviously, the only way you can pay $0 is if you only go to a hospital and if you only say you have no social security card. That's the only way you pay $0. I wouldn't be able to get an eye check. I wouldn't be able to go to the dermatologist. I wouldn't be able to get a physical. I wouldn't be able to get blood work done. I wouldn't be able to get a skincare check. I wouldn't be able to get skin cancer check. I wouldn't be able to get anything checked besides unless I had to go to the hospital and say I had no social security card, which obviously I do.
Yeah,
That's
which
the
would
only
be
way.
so are you saying that we should get rid of that? So we shouldn't be able to give out free healthcare for someone who's in need?
How is that me saying that?
Because you literally just said, so you said earlier that there's a corrupt system and we shouldn't take advantage of it. That is obviously taking advantage of a system that will incur costs that doesn't go to the person who can't afford it. It goes to the American taxpayer.
No, I think it's sick that we can't help people that don't have money.
So why aren't you paying for someone else's health insurance? You could double your tax bracket and pay for a few people's health insurance, no problem.
That makes no sense. Why would I do that? Why would anyone do that? We're talking about a big picture.
Because no, you can live the exact life that you're talking about. You can live the life where your tax dollars pay for someone else's healthcare. I don't want to live the life where my tax dollars pay for someone's healthcare who could otherwise pay for it themselves. We live in a capitalist country. Why change this from the ground up? Just so
you make no sense, and you just basically proved every single thing I said by you doing your own research.
Well,
you just did your own research by telling me what I'm telling you,
I'm the only one doing research here. So I'm the one who's
proving what I'm saying. I don't need to research it. I already have done my research.
Proving what? That Germany makes more money but takes home the same amount in pocket because they have to make more money so they can tax more of it?
I can't go in circles with you, really. You just told me that they make more money, they have only 2% that's uninsured, and they make more money than us, and they spend less money than us. So what is it?
They tax more. 42%
but they still
tax
make more money than us.
So, what?
They still make more money than us.
Yeah, that's almost entirely negated by the increase of 20% in taxes. Income taxes only.
Your take-home money is deducted by your taxes.
Exactly. It's 42% there, it's 22% here.
More money than we are. If our annual average income is what you said, $30,000, and there's what, $50,000? That's after taxes. And they have more.
No. That's not after taxes. That's not after taxes.
When you take home.
No, that's not. No, the average income is not what you take home. The average income is the amount of money a person makes.
Okay, well, you tell me that the amount of money that you're taking home. We've been saying that take home. We've been saying the words take home.
So take home is different. My take home is roughly 75% of the money that I make.
They have 2% that's uninsured, which is only what, probably less than 1 million people.
140,000 people. Yeah, so it's dramatically less than that. It's 0.1%.
We have 20 million people that are uninsured and dying. You don't care about that?
Not dying. 28 million people are not dying.
Yeah, people are dying.
They're just uninsured.
They can't afford it.
I was uninsured at a time.
That's great. How old are you?
33.
Yeah, most people are not 33 years old. Most people are in their 50s and beyond.
I'm not. What?
Most people are older and need help.
All the people that are 65 and older have health care. Socialized health care. It's called Medicaid. My dad's on it. His wife is on it. My mom is on it and her husband.
Guess what? Imagine they didn't have Medicaid. What would happen?
We don't have to worry about that because they have Medicaid. The system, how it is perfect right now.
That's a government assistance for your parents to have health insurance. Imagine they did not have that. What would they do? Exactly. It's because the government's helping. There's people that are younger too that still need that.
What younger people?
Millions of people.
Tell me what people, because you're talking, you can't just say,
my boyfriend,
millions of people.
Me. I'm a business owner. I can't afford private health insurance.
I was a business owner. I had to get out of it so I could get an office job because it had insurance.
Yeah, isn't that sad that you have to leave your Isn't the whole thing of capitalistic ideologies creating your own business, but yet I have to leave and work for someone.
Doesn't reward the people that cannot do capitalism well.
Bill
Gates has great health insurance.
You just told me that you had your own business and had to leave so you can get insurance.
That's correct.
That's the opposite of capitalism. Is that you cannot.
No, it's not. My efforts are rewarded where my efforts are applied well. If someone draws a picture of cats but they look like dogs, no one's going to buy them if they're looking for pictures of cats. So the capitalist system is going to say, no, you're not going to be rewarded with money because nobody wants your pictures of cat dogs. They're going to pay the artist $200,000.
Do you hear how stupid that is? Do you hear what who the fuck is drawing cats and dogs? Was that your business? Was that your business?
No, it's an analogy. I fixed.
So then why are you bringing it up? It wasn't your business. No one's business is that.
Okay, people fine. We'll use me as an example. We'll use me as an example because I don't know what your business is and you don't have to tell me, right? So my business was buying laptops, fixing them, and selling them. I made roughly $35,000 a year. Insurance is $500 a month. That's $6,000 a year, which would put me below the line for poverty. I make more than double that now, not include, and I don't even have to pay for health
And guess
insurance.
what? You would still have your job if the government paid for it. You would
I
still
would,
have
I-
your
and I
your
would
private
still make
business.
$35,000, not twice that what I make now. I'm in a house that I own because I didn't stay with that. I found out, hey, I'm not very good at this. It was a good thing to hold me over during 2008.
No, I'm
during the
sorry.
market crash.
I have to go because I have to go home. But you know exactly. You
I
told
don't.
me exactly
I think
what
we're
I
both
was told.
convinced that neither of us know what we're talking about. But I appreciate you being courteous and no hard
Sir,
feelings.
you looked up everything on your own and proved me right.
You just said we're not going to talk in circles, and here you go. Have a
I
good
know,
night.
but-
Send your best regards to your boyfriend.
Thanks. Bye.